New projections are showing the likelihood of eased restrictions and a slow start to the new normal for Gauteng residents. Findings from July show that the pandemic in the province dramatically slowed down due to significantly enhanced adherence. As a result, the move to level 2 does not look as far-fetched.
Despite that success, we have to be cognizant of the fact that this maximum and this drop is not a result of the pandemic having reached a peak. Unfortunately, that is not the case because the possibility for new surges are still there. The fundamentals for new surges and new increases and new drops are still there because the pandemic is essentially everywhere. Transmissions happen randomly pretty much everywhere in the province. As a result of that, it is our advice that non-pharmaceutical interventions need to continue. And that being said, of course, the province, given the success of controlling the first surge and the hotspots, we are now in a position to relax lockdown.
As Gauteng approaches a peak in the number of active cases, researchers say communities most vulnerable and at risk are those in informal and high-dense communities. In addition to this and other socio-economic factors, research shows that women are more at risk.
If I take what I started with about the vulnerability work, and here I've split it up for women. Again, these points that I have made, women are more likely to live in crowded conditions, they're more likely to have to use public transport, they're more likely to be in contact work, they're less likely to be able to have access to medical aid, they're more likely to be able to have difficulty accessing money. And when we start having a look with that against some of the spatial trends around their vulnerabilities and where particular challenges are, that starts, I think, helping province itself. And what we're recommending is to tailor specific responses to specific areas.
The Clinical Advisory Committee has put forth goals which involve the reduction of transmissions, the treatment of positive cases, and the care of those who may succumb to the virus. Now that the country has recorded over 11,000 deaths, health practitioners say it is important to have the difficult discussion around patients' dying wishes.
The issue of palliative care is not new. We've been doing palliative care for patients with cancers. We've been doing palliative care for patients for HIV long before we got to have treatment. So it is not a new, but it is a treatment that we need to also strengthen so that we can also be able to have a dignity towards the end of life. And so family engagement earlier on is an important aspect.
To date, the province has recorded over 190,000 active cases and over 150,000 recoveries. Nosipho Mncube, SABC News, Johannesburg.